Hello, All-Star listeners, and welcome to another podcast of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, please let us know.
That's right. You hear that sound?
Silence. No, I'm just kidding. Crickets.
It's the sound of a hammer because we're hammering home to write
There
a
you go,
review
baby.
on Spotify and Apple Podcasts,
Boom.
especially Apple Podcasts.
That's
'Cause
right.
They help.
Okay.
I was like, what was that sound? They help boost the algorithm. I can't talk.
Algorithm.
117 on Spotify, 32 on Apple Podcasts.
Yes. Okay, so keep it coming.
Yeah,
We love the reviews. One, because then we can make it better.
that's right.
And then, boost the algorithm.
Wiggle our way to the top.
Wiggling our way to the top. We really
next
want
to
to
Joe
help
Rogan.
other people. So this is very exciting.
Is he number one?
I don't know. I just
We are
know
very
he's
high up, Harrison.
No, she
right?
compared us to
Harrison's
Joe
nodding his
Rogan.
head
I
over
can't
the
see
TV,
him.
which I can't see him, but
Yeah,
I
I
can see
can't
his
see
hair
him.
going like this. So yeah, we're like very much at the top
That's
of
pretty cool.
veterinary podcasts.
That's
Yeah.
pretty cool.
Thanks to you guys. You, and you.
And you.
Thanks.
And him.
And Harrison.
Oh, Harrison honestly
Harrison
does all
actually is
the work.
probably all doing all the work.
Yeah.
We just sit here and talk.
You should bring in a prop now when they have to say that, because every script says hammer home, and you should bring in Thor's hammer.
Wait, we
and
have
someone
this
should
We
dress up as
totally,
Thor.
we totally
That
need
I
to do
didn't
that.
get to use, by the way.
And somebody
Okay.
just swing it around while someone's
Yeah,
talking about the
I saw
review.
that.
I'm
I
gonna
was
bring
like-
you a pumpkin. You can hammer it away.
Please.
Okay.
Because I had a name on a computer.
Yeah,
to
I
smash.
saw that. I was Devyn's gonna be angry.
Okay, well, you know
No.
what? It's okay. We have other things to smash. So we can smash
supposed to
more
put it on?
pumpkins.
Yes.
Side note:
whole
we had
podcast.
old computers here at the clinic that they're broken or something, and so they smashed them with a sledgehammer to release
Tension. Stress. It's
Tension,
actually
yeah.
going to be one of our things we talk about later.
Oh.
You know, because in our listener question, but we also had pumpkins because it's almost Halloween. So Devyn's angry because she had her name on.
Looking at me, King.
Yeah, can you what? Can you see me?
Yeah, I see you.
There's
Yeah.
These are net.
No,
netted.
yeah, okay.
That has to be uncomfortable.
I'm totally
Can you
wearing that at
breathe?
my house to scare the children.
You should. I want to put it on, see what Miles does. He'd probably attack me.
Yeah, he would have.
I think it
When I
would
had the
scare dogs.
Avatar mask on, he tried to kill me. When we filmed the Avatar
This
video.
is her own dog, by the way.
Yes.
Okay, our last episode too was with a special guest, and we did a new I don't know. Harrison did a system where it looks good. We talk, and then he shows
That's
up on
good.
the screen and talks because it was.
It worked well. I mean,
Tele-
yeah,
whatever.
he did some other program to
Yeah.
make it work. But
Yeah, I thought it worked really well. And it was
he's
fun.
and he's got a lot of personality.
Yeah.
And
That's right.
he's excited
Gusto.
about gusto.
Get
That's
those
the word I'm looking at.
bandages on those dogs.
That's right.
and
Very
cats.
cool. Very
Yeah.
cool. Very cool. Very cool.
Okay.
Very cool. Yes.
Intro.
Loved it.
You're up.
I'm up. Improvise the introductions. Today we have Devyn,
Read what is it?
room assistant extraordinaire, hostess with the mostest,
Mm-hmm. Mm-hmm. Mm-hmm.
right?
Oh, yeah.
And one of
I
our
was just
main
thinking about it.
actresses in
Star, if you will.
Star, if you
She's
will,
a star in Hollywood.
for a lot of our
Super.
video
Mhm.
office series
Yes.
/ other
The
things.
the vet
She's
clinic.
always willing to just
Mhm.
sacrifice her body for the greater good.
I will
She's
say,
had
a comedy.
cheese on her face. She's had peanut butter on her face.
Fake blood now.
Fake-
I've
Yep.
really grown in my acting skills since working
Yeah.
here.
You know, you really have gotten more comfortable
Very
and
natural.
out of
I
your
have.
shell.
Yes.
I used to be so camera shy.
Yeah.
You're
it's-
just also shy in general.
Yeah.
I will
So-
say, I actually went back and watched some of those videos again. I was laughing so hard at the cheese in
the
her
cheese
face.
is amazing.
But the
It was
peanut butter
good.
one, and then there's the
Drool.
the
The
drool, and
drool.
that episode or video
Mhm.
is so freaking funny. I just kept rewatching it.
The cheese,
I
I threw cheese at her at least 4 times. At least.
And I was
like she
actually-
was caked. You just
It's
couldn't
the
see
sound
it.
where it's like,
I mean,
oh.
it's great because it's just like,
Yeah.
you know, like with the sound
Yeah.
effect.
I was
It's
just
great.
telling her this morning about how I got cheese all over my car seat in my car. I found out.
Look
the
at that, you're
next
even
morning 'cause it was
sacrificing
all
your
my
car.
hair, and it was just sprayed.
You're in it
cheese.
to win
True
it.
MVP.
You're in
It's
it to
fun.
win it.
Yes, new video with fake blood coming
Soon.
Monday.
Mm.
Oh,
Friday?
awkward. It's out. Go watch it.
Go watch it.
Okay, day before Halloween.
Yes.
I almost said
Love it.
Thanksgiving.
We also have
Close.
Courtney Bond, veterinary technician,
Mm-hmm.
here with us.
Newlywed.
Newlywed.
Courtney Allen.
Whoop, whoop,
Yeah.
Oh,
You
that's
haven't
right.
changed your
This is
last
what I
name yet.
can't do. I can't if I
Everybody's
know the
gonna
person
call me
prior
Vaughn.
to.
No,
And you
it's
can't
fine.
change your vocera. It's just
Please
gonna
don't.
stress me out.
I won't. But you know what I said I was going to do today?
What?
Write CA on one of my PVOs just to really throw Christy off.
Oh, you should totally do it.
Yeah.
Because like, you're just gonna be like, who did we hire?
Another new person.
Because Allie Cook, I never call her McQuarrie.
No, and I
No.
accept
I don't
that.
even
You don't
know
have
what
to
her
call me
married
Alan.
name is.
It's
You're so
Becca
nice.
Fidel. It's
Becca Fidel.
yeah.
Yeah.
No,
Okay.
I know that here I will never go by Alan ever.
No.
Which
It's
is
not
fine.
that we don't accept your new last
No, and
name.
But we
I'm-
don't accept you.
I
But
am
we
a little
just- that's
sad.
your
I do
nickname.
love Vaughn, so we
It
can
is a
keep
cool
that
name.
going. I really like my last
Okay.
name. Yeah.
You could be like Courtney Vaughn Allen. That's not
Yeah.
so
I
bad.
thought about
Yeah.
hyphenating
Yeah.
it, but people I've
Von
talked to
Allen.
said
Alan Von.
it tastes good. It sounds good, but I'm really hungry.
Yes.
I know. We got
Yeah.
food out there. We gotta go. We gotta move and groove.
Okay, let's move.
getting
Also
shaky.
on the podcast, we
You.
got Dr. Ashlyn Duckwall in the house. Okay.
And Dr. Emily King
Woo, woo.
bringing down the house.
That's
I feel
right.
like we have not been here
Yeah.
all together.
Well,
It's-
because we had the guest podcast and
I
then we
know.
had
Yeah.
Yeah.
Yeah, I know.
So, like,
We're just
I was
It's a
gone.
thing.
She was gone.
And the Ducky team's back together
yeah.
Duckwall Dynasty.
Oh, that's
because I was out for
really
2
good.
weeks.
yeah,
Wednesday was
we're
my
the
first
Mighty
day
Ducks
back.
or Duckwall Dynasty.
I like Duckwall Dynasty.
I
That's
do
what
too.
we have a
It's
group
like
chat, and
it's
the
like
Duckwall
an
Dynasty.
era.
Yeah.
Mhm.
You know what I mean? Like
Not
dynasty.
just an era.
You're like a era's a long time.
Yeah. I guess.
Don't you kind of want to be an era?
Yes.
Yeah, you
yes.
do. That's what a
Okay.
dynasty is, right?
I think
mean,
of
like
eras as short-lived, but
you feel like an era is short lived.
I
Yeah.
think the word sounds weird now.
I don't know about like
Era.
It just makes me
scientifically,
think of
but
Taylor Swift now.
yeah,
Okay.
that's what I'm thinking. I don't like her.
Why? Well, let's not bring up Taylor Swift.
Yeah.
Let's
We're
move
talking
on.
about infinity and beyond.
That ended the conversation real fast.
Okay. Well, everybody's talking about Taylor Swift, so
I
like
know.
that's
Yeah.
old news.
Right.
Whatever.
She
Okay.
used to be country, by
Don't
the
get
way.
me started. I know.
All right. This first question is amazing because Devyn's nickname is Pop Tart. So is a
Shall I begin?
yes is
Yes.
a Pop Tart a ravioli?
No.
That was very.
That was like
Confident.
I've never heard that question
I'll give
ever
my-
before.
Yeah.
I've never
Where
even
did
thought
these
about it.
questions come from?
Google.
Yeah.
so. I don't
We
know,
get a shrug.
guys. I mean,
I'll give
How do you
one
def-
when I'm
no,
done.
okay, wait,
yeah, how do you,
how do you
wait,
define
guys,
ravioli? Will someone look up the
stop. I
definition of
already looked it
ravioli?
up. I
Pasta.
always look it
Oh, you
up.
did?
Oh.
Okay, what
Yes,
is it?
It says that it is pasta.
Oh, its a definition is pasta.
Well, it says pasta in the definition. It's not just pasta.
Okay.
But
A pasta with
A ravioli.
Pop-Tart is a pastry, not a pasta.
Oh.
But I don't know if pop.
Yeah, because America does the synthetic, weird made Pop Tarts, whereas I'm sure in Europe they do fancy Pop Tarts.
They're probably like banned in.
Why do you think in Europe they do fancy
What-
Pop
why
Tarts?
because
does
they
Europe
do
have
lots
to
of
do with
pastries.
anything?
They
Do
do
you
so
really-
many pastries.
bans
Europe
a
is
lot
Do you
dangerous.
watch the
of
Great
American
British Baking
food.
Show
I
on
think
Netflix?
Europe makes fancy Pop Tarts. Okay, so who's
The
gonna go
Great
to
British
Europe
Bake
and
Off.
see?
Yeah, okay.
No, like Mountain Dew's banned over there. Like they banned a lot of.
I mean,
My
they're not.
in-laws-
That's not
unhealthy
bad.
foods and
My in-laws
drinks.
just went to Italy and there was a test run McDonald's there. A test run.
They will ruin
With
the blue zone
pastries
in
and look-
Italy if they bring in all that stuff.
Yeah.
You guys know about the blue zones, don't you?
Yes.
No,
yes.
because you're all young.
Yes.
You
no,
need
I
to
do.
worry about continuing to live.
Yeah, there's
Okay.
Netflix. There's a whole
Yes,
documentary
it's
on it.
absolutely fascinating.
Yeah, there's certain places that they live super long.
Yep.
What classifies something as a ravioli? Ravioli consists of a wrapping made of egg pasta that can be filled with various ingredients like meat, ricotta, cheese, and vegetables.
But then
If you took out the word pasta, it would totally
Ravioli
be a
is
Pop-Tart.
small
I wonder-
pasta envelopes containing ground meat, cheese, and vegetables.
If-
That ravioli sounds great.
the root word "past"
Okay.
means anything.
Does the
It's-
root word mean
It's
pop?
in pastry and pasta.
Ooh,
You look that up.
interesting.
What?
Okay, the root
I was
word.
reading about
She's going to
Oh,
Latin
we're
right
going
now.
to linguistics.
She's going to Latin. Her Latin
Oh,
roots.
my God.
P-A-S-T.
P-A-S-T.
Yes.
Look up the Latin meaning.
Wait, you got to put it's
Dun,
the sub.
dun, dun,
it's,
dun, dun,
the root.
dun.
Is it root? Would you put root
I would
or
consider that the
yeah? It's
root.
not a prefix. Yeah.
Mm.
Oh gosh.
Anything?
Not really. I don't really understand any of this.
All right.
Okay,
Yeah,
let's
that
move
was
on.
inconclusive.
To be
I
continued.
think no. I'm just gonna say no.
Okay, we're all
No,
voting
no,
no,
no.
because
Okay.
it did not have meat or cheese.
And it
Although
doesn't have-
some Pop Tarts.
It doesn't even have stuff in it, actually.
Pop
It's on
Tarts
top.
or raviolis?
No, Pop-Tart
Pop-Tart.
has filling.
No,
Oh.
Pop Tarts have filling
Never mind.
Pop Tart.
Totally spaced
Have you
that,
ever had a
yes.
Pop-Tart?
Yes, I was thinking.
I brought you a box of Pop Tarts when
I
I,
was
named
thinking-
her Pop
No,
Tart.
I was thinking of. Never mind.
What's your favorite Pop Tart?
Blueberry,
Totally cinnamon.
Cherry,
blueberry.
cinnamon.
I like me some
Do you
cherry
guys toast your
Pop-Tarts.
Pop-Tarts?
There definitely is stuff
Yes.
inside.
Yeah.
Yeah.
Because it makes it warm.
Depends on my
No,
mood.
you don't taste
Monster.
your Pop-Tart. What was your favorite blueberry?
S'more.
I
is
can see where
also
you wouldn't
very
toast
good.
blueberry.
It has like little
I
sprinkles
toast
on top of
cherry.
stuff.
Oh my gosh, those cinnamon
S'mores like dessert
toasted.
for breakfast.
Have you guys ever made it even worse for you and you toast it and then you put butter on the top?
No.
Holy
I've never
cannoli.
Butter on a
Try
Pop-Tart?
it.
I've toasted
Yes.
that, but
It's
cinnamon-
amazing, and it's just worse for you. So really, don't do it because,
I'ma
but
do it.
do
But
it.
Pop
Try
Tarts
it.
are bad.
I'm
for
not
you
living in the
anyway.
blue zone.
Right.
I don't like the
Just
cherry
add a
orange.
little bit more. Oh, I love
Just
cherry.
saying.
They're
Okay.
so good.
Okay, what's the best way to start the day? Courtney?
Best way to start the day? Like just one thing, or like what equals a
Waking
good
up.
morning?
Going back to sleep is what I was going to say.
I was gonna say you like
Your routine.
Ooh, I don't know if that would consider start of the day.
Okay, you think about
Wow,
it.
you're
Okay.
really struggling.
I
over there.
know.
Devyn, what do you think?
She did not have a good start to the day. I would say wake up refreshed and not feeling like snoozing my alarm a bunch of times.
Yeah.
Getting
Good
out of the
night's
door
sleep.
on time, which is 7, and having a good coffee. Those are my
Ooh.
3.
If you do those things, you're like, I'm in it. I'm ready.
Yeah.
Mhm. The coffee plays a huge role.
It does. I get
And-
excited for coffee.
And getting out of my house on time.
yeah.
I was like, I thought you were going to stop at getting out of my house. I
Oh,
was
no,
like,
no, no.
what's wrong?
No. Just
On
because
time.
then I'm here
Okay.
early and I have time to like get everything set up.
You're not like rushed.
Yeah.
Yeah, because being rushed, that creates chaos.
Yes.
Chaos
And
is
once
not good.
once our day gets going, it doesn't stop until
Nope.
So you want to be
6.
prepared.
Yes.
Yeah.
I like it.
A good start to the workday is when a client brings donuts.
Mm.
Yeah,
That's
good.
to the work day, but
that is.
I would say coffee if I can't go back to sleep. But
If you-
usually,
if you're
I
like
can go back
up.
to sleep.
That's what you're picking is if you have to be up, you're going coffee.
Yeah.
If you're allowed to go back to sleep after waking up, you're saying sleep.
Yes.
It's a good start of a day. I don't know what. I
because
would
like
say-
that's for work days, I guess. I'll say.
No, because then you're
Yeah.
going back to sleep. Yeah, I don't know.
Yeah, I mean, for me, it would depend on whether it's a work day or non-work day.
A great start to
Because-
the day would be like waking up at like 9:15 and it's raining outside, and then you go
Mhm.
downstairs and get your coffee and cuddle up on the couch.
Mm.
And then
That
it gets
sounds
sunny like a little
nice.
bit later in the day.
No,
and
you
can
need
go
like a
outside and hang
totally
out.
rainy day.
Yeah.
And then
Waking
you can
up
just
to like
never
rain
get off the couch.
and then staying in your pajamas and going right down to the couch and then right back to bed.
Yep.
That's just a good day.
I start my day with tea. With
Tea.
yeah, because I don't drink coffee,
Oh yeah, that's right.
Mhm.
so
Hot tea is really soothing.
it's good. But
I
I
don't
put
like
this like
tea.
little flavoring in it, so then it's not like bland tea.
Yeah.
But I've really been into this orange, turmeric tea.
Ooh.
And it's pretty good.
Okay.
Have you had cinnamon
I
tea
have.
before?
Just a
What?
tiny spicy, but not like bad turmeric spicy.
Yeah.
And so I start with my day that way, and yeah,
She's getting really excited.
I'm not getting excited, but one time I was walking through a Kroger and they have like those little immunity shots.
Oh, yeah.
Ooh, those burn.
And it was turmeric or whatever, and I took it
oh
just, like,
goodness.
nice and quick,
And
and
you were
I felt like
expecting
my
it.
esophagus was burning.
Oh.
It was bad.
Yeah.
It's
I've
I've never
intense.
seen these things.
So the tea
it's
doesn't-
an
the tea doesn't taste
anti-inflammatory,
well.
so it's
They're like-
no, I think I've seen you take one actually.
Probably.
I don't know.
They're just health shots.
Oh,
Like it just has good stuff. There's a lot of variety.
Yeah.
Just good for
Like
you.
my eyes watered.
oh god.
Oh, it
Yeah.
hurts.
Sounds like the one.
You can also
spicy
make
chip
them at
people
home.
The
eat.
tea's not like
the
that.
what?
The spicy chip that people would eat just for food.
Oh
Mhm.
yeah.
Oh, that's
Torture
just
themselves.
stupid.
Yeah,
yeah.
I wouldn't do that.
That would clean
Well,
out your
and turmeric
sinuses.
is not a pepper.
No.
So the chips are peppers, right? I mean, that's like the
Yeah.
The
ghost
chips
pepper.
were sending people to the hospital.
Yeah, that's
I'm
just
pretty sure
Clear
somebody
out
died
your
from it.
GI system as well.
No, it'll
as
clear
your
out,
sinuses.
clear it out right
So
into your
technically
abdomen
it's
as
a
it
good-
creates a hole in your.
Does not sound healthy.
Okay.
Okay.
Um.
Ooh, the
oh,
best
yeah.
condiment.
Barbecue sauce. Oh, I love barbecue
Ranch.
sauce.
What is yours?
What
ranch?
Kind, what kind of ranch?
Homemade ranch or
I-
like store bought? Let me guess
What's
for
your-
you. It's
Hidden
Hidden Valley.
Valley. Yes. I don't like Hidden Valley
I
Ranch.
almost said ranch.
I like Ken's
Yeah.
Steakhouse Ranch. That's my favorite ranch in the grocery
Right.
store.
Okay.
The
Homemade
best.
ranch is really good.
Mhm. He's like,
It is.
look at
I
ranch
know.
in
I
general.
know. Look
I
who we're
really
talking
like
to.
ranch. You can use it on like
I don't even
everything.
like making simple syrup, and that's water and sugar.
Right? Oh my gosh.
funny.
Barbecue sauce isn't a bad choice.
I love
I
barbecue
hardly
sauce.
ever use it.
Mm.
Yeah.
I would say Dijon mustard.
See, I don't eat Dijon
Ooh.
mustard. I don't even think I have bought that
very
yet.
really like
Tart.
it.
Is that
Ever.
how you describe it?
I would say spicy.
Spicy-ish. Like, yeah, a little, not horseradish-y too much, but like
No.
just a little bit of spicy.
Yeah. Is soy sauce
I
a
like it.
condiment?
Yeah?
I love soy sauce. I put that on everything.
Yeah.
Wow.
I'm also Asian, so.
My favorite barbecue sauce, though, is Blue Hog.
Oh.
Blue Hog.
Is that the
barbecue
one
sauce.
you brought Yeah, I went and bought some.
Did you?
Because I fell so in love with it. It was so good.
It's so good.
Yeah, I went and bought it. I found it and I bought it.
Yep,
it's so
one
good.
of my favorites.
I had this thing when I was younger where I would mix my ketchup and mustard and call it custard. And it was really good. It's like
they
orange.
sell that now.
I know.
They sell
I should have invented
You should have
that.
invented that. You wouldn't be here, but
I talked about
that
it
would be
with my
great.
mom all the time. I was like, I'm going to invent this one day.
Yep.
I was like, do I call it custard or matchup? That's what I eat with my corn dogs. Yeah, it's good.
The mixture.
It's so good.
Yeah.
They sell everything in
Yeah.
those bottles now.
They're all just
all the
mixes.
Everything is mixed. It's
I
like
think
sriracha and
yeah.
mayonnaise, and then it's
They have
sriracha and ketchup, and then
ketchup and
Yeah.
mayo.
yeah.
Yeah, they have a lot. Sriracha ketchup is so good.
I still have not gotten that
It's
yet.
so good.
I need to get it. I haven't
Yeah.
gotten it. You talked about that one time.
It's worth it.
Bang bang sauce.
Oh yeah,
that
Holden
stuff's
loves that
good.
stuff.
Yeah.
Mhm.
Jacob's brother is obsessed with yum yum sauce.
Yep, that
Maybe
too.
that's-
Holden loves
He's
that
always
too.
stocked
Similar?
on it.
I don't know.
I think it's like a light orange.
Whatever
Yeah.
comes
Yeah.
in
It's
the,
light
like,
orange
Kodo
sauce.
or, like,
Yeah.
those
Yeah.
restaurants. That's just good. That's yum yum sauce. Yum yum. I don't know what
I
bang
think
bang
so.
is. I just kind of said it.
All right, on to cases.
Okay.
All right.
Eh.
Courtney, you want to go first with case? No, you didn't want to. Devyn, go first with your case.
I haven't been here
just
for
your
2 weeks.
face.
So I'm not.
Mayday.
That felt intentional. Yeah, I guess. So this is really long.
That's all right. We're here.
Yeah, we're here for you.
Let's go. Let's hear what you have to say.
We had a 7-year-old female German short-haired pointer come in. The initial complaint was she had red eyes. And then when she got here, the owner had mentioned that she had started having a dry cough a few weeks prior. And then one of her eyes got red, and then the second eye became red, so they brought her in. A few days before the appointment, I guess she had started coughing up a little bit of blood. The cough became productive. And then what we did here was some thoracic x-rays where we found some nodules on her lungs. We also did some blood work that came back pretty unremarkable, but we sent the x-rays out to be interpreted for further evaluation, and it came back with 2 differentials. Number 1 was pulmonary metastasis, and then number 2 was pulmonary abscesses or granulomas. Then they recommended an abdominal ultrasound to check for neoplasia because, unfortunately, cancer was at the top of our list. So we did the abdominal ultrasound and found something that was concerning for a urethral mass. Mentioned that to the owner, and then they were like, oh, that makes sense because she started to strain to urinate a little while back. And at this point, we're referring her for a cytoscopy and biopsy.
Really?
Yes.
Hmm.
And so
I saw this mass, so I'm really
Yes.
surprised at that. Why?
we're not
Question.
we they have not had the chance to set up that appointment yet, so we don't have any information on how that referral is going, but that's where we're at.
You know, I guess so go back. There's a couple things.
Yes, there's a lot.
Rewind. Because I want to point out a couple of things. Probably you do too, Duckwall, in terms of the history that are important for people that are listening or learning as well. So, like the bilateral red eyes, right?
We did start anti-inflammatory eye drops.
So when you have a dog that's coming in for illness or is not doing well, but it has redness with both of its eyes, then that's kind of like a little light bulb that goes off in our head because the dog probably has uveitis.
And
when
that
you
was
have-
one.
Yeah, when it has bilateral uveitis, so like both eyes now are affected, and you have other symptoms involving their body, then our minds go directly to, okay, this dog has some type of systemic illness. So then you throw in the coughing blood, which we don't see that. We just don't see dogs coughing blood.
Yeah.
So that was McDivitt's other clue
Yeah.
to go, that's not right.
concerning.
Let's take
Yeah.
some x-rays.
Yep.
So then you see the nodular pattern.
Yep.
The reason why I was like, with the referral, because you already have,
All the information you need. to
and you have
understand.
you have metastatic disease. You
Yeah.
have
Yeah.
nodules in the lungs. And I saw this tumor on the ultrasound. I mean, it's not some like, there might be a tumor in the bladder. I mean, like this thing is occupying, it widened the urethra to 1 centimeter.
Oh, wow.
Yeah, I could follow the urethra all the way down to the pelvic canal. And like at first it looked like a colon.
Yeah.
So McDivitt had me
Oh,
come in.
wow.
That's why I came in.
Oh, wow.
Because it was the neck of the bladder. So the bladder comes down and it comes into a, balloon looking thing. So there was the mass at this part of the bladder, but then you could just open up and it just followed it all the way down like a tube.
Yikes.
It was all.
Well, the fact that it could have been mistaken as a colon, that's.
Yeah, I mean, it was impressive. Let's just say that.
Oh, boy.
Multiple centimeters long.
Yeah.
So that's why I was like,
What are they
that was why my
referring-
reaction was like,
cytoscopy,
weird.
biopsy.
because what are you
That
going
would
to
be a
do?
good-
Yeah.
And
Just
why
to
don't you
notice
talk
things,
to like
just-
why I'm saying,
For sure.
So,
diagnose.
I mean, the biggest thing is, you're looking at quality of life at that point. Like,
right?
the prognosis is guarded because it's already been there long enough to distort the bladder itself, but then it also has now been there long enough or aggressive enough to go to somewhere else.
Mhm.
And so then it's like at that point, especially with the cancer in that area, it depends on, of course, what it comes back at, but you have your suspicions and how well it's going to respond to chemo and like just is the dog comfortable because you worry about, is it going to keep progressing where they can't urinate? And that's emergent. Like that's a huge deal. Now I say this and we're doing chemotherapy on a dog today. We started it. That's stage 5 out of 5 lymphoma. But lymphoma, there's a whole protocol and they can, you can still get.
If you're going to get cancer, it's the one to get.
Right. Because it's the one that you can get a little bit more time where you can get more time. It just depends on how long we can get. So anyway, it's just.
We're talking about canine patients, by the way.
Yeah, we're talking
like
about
when I
canines.
say it's the cancer you want to get.
Yes.
Like, I'm talking about dogs.
Yeah.
Okay.
Yes,
I don't want people to be like, oh, I need to,
Yeah.
if I get cancer, I want to get lymphoma.
Yeah.
No, I'm not talking about people. I'm talking about
We
dogs.
only talk about
Animals.
animals here.
Yeah.
Yeah.
I will add in really quick before we move on that she is still eating and drinking fine.
Good.
She's acting a little mopey, but nothing significant.
Well, in her bladder, she was retaining urine.
Yeah.
So it made it easy to find the mass because she probably, because then we said, McDiv and I were talking to, I think Josie was in there with us, and we were like, take her out and watch her urinate because I bet you anything. And then that's probably then when they went and asked the owner, after they saw what they saw, and then they, hey, by chance. And it's oh yeah, now that you mention it.
Yeah. Is she urinating blood? I do not believe so.
It's just a horrible, bladder cancer is just, we see that in dogs, and we use dogs as a way of finding out information about people, right? With bladder cancer, didn't Purdue do that?
And with Dr. Knapp, yeah,
That's cool.
and it's still, there's one type that we usually see, transitional cell carcinoma, TCC, and there is a chemo protocol for it, and they, sometimes they can resect actually bladder masses too. Dr. Jones has a patient that had that done, but with the sounds of this, if it's a tube and it's following, you can't.
And it's
We had Dudley had a patient. Big dog. Oh my God, what's her name? She rescued Diver Boyd, that German Shepherd who lived here for like 3 days. Susan Lawhead, Rudy.
Yeah.
He had TCC for like a year or two.
And it really helps if it's at the other end of the bladder.
Yeah. It wasn't in the urethra by any means, but he lived for a decent amount of time with it.
Yeah.
Yeah. We'll
Very
see.
cool. Unfortunate for the pet, but very interesting
very
case.
interesting.
Yeah.
Because that was a very interesting workup, and it was very like methodical, like to be able to work through it. It's a very interesting case. Good one, Devyn.
Thanks.
Good job, Devyn. Way to be there for Remy. Okay, mine's not, medically it's not that exciting, but I had to talk about Murphy because Murphy is a 245-pound dog, you guys. 245
Oh my God. Was that the one Harrison was helping you with?
Yes.
Oh my gosh.
Yes.
That dog's huge.
Yes. It's the biggest dog I've ever seen. He's a Great Dane, and he just is the biggest Dane I've ever seen. Like when he's standing normally on all fours, his head comes up to my face.
Yeah.
And
I have a
I'm
picture of him standing next to a boxer.
Yeah.
And I'm like,
I took a
gosh.
picture with him on whenever he was here, and I'll have to show you.
Yeah.
It is so crazy.
Weird. It's just weird, isn't it?
Yeah.
Probably.
And even pictures don't do it justice.
Yeah.
It's just like, but he's so sweet. He's the definition of a gentle giant. And the reason why I wanted to talk about him is because, well, he had an injury to his paw, and his paw pad was sliced open, but then there was also areas of the paw that were really swollen and red and painful to touch. So we talked through, is it like a cellulitis thing where he had an infection or inflammation just under the skin, versus did he, with the injury, because they don't know how long had been there, what had happened, is there something, we worry about foreign body in that injury or a broken bone, essentially. Now, he was limping on it, but when I palpated in the exam, I was like, I don't think anything's broken because he would let me know. Like broken bones are so painful. But But we did proceed with x-rays just to ensure, because of the swelling, all the factors. We just said, hey, we don't know how long it's been here. We need to look. So the difficult part is number one, you have certain limitations on drugs as far as the amount you can give. And I'm so thankful you brought that up, Dr. King had mentioned, because it's like, yeah, you originally would be like, okay, he's this heavy. I'd give this much drugs for his size. But in a dog that size, which we never see, you cannot give the full dose because it's just too much. So, and large breed or giant breeds, they're more sensitive anyway, like a horse.
Yeah.
So we had to cap the drugs, which is important to remember, but he did fine. He did great. We essentially gave him half of what he needed, and that's still the max that he could have gotten. So he did well, but we literally had 5 people, and we had Harrison helping with his muscles, and you have to be safe because you could easily hurt yourself and
hurt the dog by dropping, you know, I mean, like, God, can you imagine him falling on himself, like his neck or head or whatever?
Massive.
Yeah. So we had to be very methodical. We had to make sure our timing was right with enough people. We just kept him on the gurney and then just pushed his leg over to the x-ray so that we didn't know how much.
That was good thinking, actually.
Yeah,
like just making the gurney level with the
too big for the x-ray table.
Well, that's the other thing is like you have to consider, is he going to break
the weight limit on that thing?
And so it worked fine with just pushing his paw over, and we got the pictures fine and they were appropriate, but nothing was broken. There was no obvious worn material. If it was a piece of grass, you can't see that on x-ray, but most likely it wasn't. And then I also, at the same time, so anyway, I treated his injury with an anti-inflammatory, antibiotics. We cleaned it. And then at the same time, he had this like
little friend.
Dangly friend on his one nipple.
Oh, that's right.
And it started to like kind of just get down further and bother him.
Got the best of it.
Yeah. So I also removed a little nipple at the same time because he was already sedated. And we didn't send it out. We just got rid of it. But he recovered great. You just have to be so careful with moving him too, because you don't want to rotate him the wrong way. I mean,
oh yeah, there's so many factors.
245 pounds. He should be like 220, but that's still 220.
Still 220, even at 220.
Yeah, I'm pulling this.
That's
out.
is more than.
How quickly was he
just-
up and walking after you reversed him?
I think it was pretty quick because he was like twitching a little bit by the time we were stimulating him with the mass removal. But yeah, he was pretty quick to recover.
Did you see him
which
when
is
he
good.
was here?
Yeah. Oh my God!
I was gonna say,
did you send that to Harrison? You got you.
I have
that
a
is
picture
impressive.
before he was full grown.
I posted.
Yeah.
And then that's him sitting down and me standing.
That's so cute. You need to send that to Harrison.
He took it.
Oh,
he
he
has it.
took it. Yeah, that's
That's
amazing.
him sitting.
Oh, yeah, that is
What's
him.
great is that he's a nice dog.
Yeah.
Right.
That's
I
before
mean,
he was full
That's
grown.
the other thing.
Great
It's
dog.
like
He was
I
young.
literally told the owner, I'm like, thank goodness he's so sweet, because
He is.
can you imagine trying to control something like that? That's
you
unpredictable.
can't. It needs to go in a squeeze
No.
cage. Like you couldn't. Like it
Yes.
needs to go in a cattle squeeze cage.
He'd
Yeah.
be a
What
safety
are those-
hazard. And then it's like walking him. She's like, oh yeah, I need help getting him in the car. You know, just all the things that you're just like,
If you couldn't touch him,
right.
Wow.
No,
And then
he
just
is a
everything's
sweet
more
boy.
expensive because he's
very sweet.
ginormous.
He's awesome.
Yeah, that's like 3 dogs. Think about that. Like 240 divided by. I mean, that's 80-pound dogs.
Woof.
That's like so expensive.
And 80 pounds is still a lot.
But I mean, gosh, great.
Yeah.
You can have better owners. He's
No,
such a
they're
sweet
awesome.
dog. Like it all just is a good, happy scenario. It's just like,
Whoa.
Yeah.
His legs
Very
are
cool.
like.
Put a saddle on him.
yeah, literally.
Oh my gosh. Okay, my case is based around Labrella. Good job, guys. Wow, that was really good.
We need a happy button too.
I know. We need a happy button, Harrison. Oh, he's nodding
This
again. I
says
can see that he's
fail,
nodding.
but we
Sounds
need
like happy noise.
success.
We need one that's like doo, doo, doo. I don't know what.
Yeah.
We'll just do it.
So I'm going to use my own dog to talk about Labrella because she's really old. 14. She's 14.
My dog's getting it
14.
today too.
I might do it on my dog.
Okay. So Labrella is a new monoclonal antibody therapy manufactured by Zoetis, and it's it addresses, it's an anti-nerve growth factor that it addresses. Anyway, it is used for chronic arthritis in dogs. And so we got it into our little hands a couple weeks ago. And so we've been using it. So I have a 14-year-old English lab that
Named Pickles.
that is the best dog ever, but she has arthritis in her feet. I was going to say her hands, her feet, her front feet, and then obviously in her knees. I'm sure she has it in her back. Let's just be honest. She has it everywhere.
She is walking arthritis.
She is walking arthritis. And she's been chronically on Rimadyl, and Rimadyl. That's just it, really, because
Lots of Rimadyl.
I'm a veterinarian, and so then that's as much as I can do probably every day. So, but weight loss, she has like her weight's good. Like I don't remember when I brought her in, she was like 78 pounds.
Yeah.
She's good. Killing it with her weight.
Good.
Nice.
That's good.
Yeah.
Okay, Pickles.
Yes, go on, Pickles. Right?
Backstory: Pickles has been a little overweight,
Like
for a long time.
Yeah,
but it's not her fault.
It's not right. I know it's
She
my
can't
fault.
help it. No, it's not.
So Librela gave it to her 2 weeks ago, 10 days ago or whatever, and she's doing better with Librela on board. Librela is once a month. And the one thing I wanted to mention, or the one reason I wanted to talk about it, is that when you start Librela in a dog that's on chronic anti-inflammatories, it's not like you can give Librela and then take away your meds. Mm-hmm. So what I'm doing is I'm going to use Librela and Rimadyl together. And then at the end of a month, I'm going to repeat her Librela, and then I'll drop her Rimadyl down to once a day. Mm-hmm. Then I'll drop it down to every other day, and then I'll take it away. So I did not know. Did you know that only that 60 number where she was like, out of how many days out of a year you give people given NSAID, the research shows that it's only given 60 days.
Really?
Yeah. Huh? I'm not great about giving it every single day, or twice a day, but I didn't realize that people, which it makes sense. I mean, if you look at heartworm prevention and other things, but as far as being compliant, I was like, oh my word.
I did not know that.
So that's the other advantage is that.
Year?
What did you say?
If I'm supposed to be on it chronically?
Yes.
They only give us 60 days out of the year?
Yeah.
Half the year.
Yeah.
What?
Well, yeah.
That's 2 months.
I know.
Yeah, it's consistently. There's math is hard for us, right? So anyway, I was really surprised by that.
Yeah.
I thought it was going to be 180 because I'm thinking to myself, I at least give it once a day.
Yeah.
Really?
She was like, no, the research shows it's 60 days.
I would
really?
So the reason she's bringing that up is that Sarah, our person who we love, is that it's an injectable. So you give it, you don't have to remember it. So, and with arthritis, the whole goal is to have them not live with chronic pain because chronic pain leads to other problems.
Mm-hmm. Well, and the biggest thing too is that it's not metabolized so heavily by the liver and the kidneys like Rimadyl, and how that you have to have annual blood work with that every year because it can. I mean, you don't want to do any harm, but no medicine is benign. And at least Librela is not.
We don't have to run labs in theory. Like if you had to save money or if a client had to save money, you could just use it on the Librela and not the labs.
Yeah.
So we're super excited about it.
And just to remind, if you're starting a dog on the Librela, sometimes it takes the 2 doses back to back to get full efficacy. So you really want to do definitely the first 2. Obviously it's once a month, so you want to do it every month, but the first 2 you can't just say, oh, got one and it's not working.
Yeah, right.
Really
is there research for if they get the first 2 and then stop getting it, does it stay effective or does it wean?
I think it'll come out of their body.
Yeah.
And I think that's kind of the approach we've taken from the standpoint of we're counseling people to give 3 injections, and then if someone doesn't think it's working when they stop it, they'll be able to tell them what it was doing, because by then it really has taken a pretty good effect. And so then when they take it away, it's like, ooh, okay, yeah.
It was actually working.
It was actually working.
Yeah. Someone was texted about Librela in the group chat.
Oh,
look at that.
They're listening.
It's so,
It's great. We're all doing it for our pets, so you do it.
Yeah. I mean, I'm so happy that we're starting to get some of these more advanced products, for our patients. It's so cool.
I'm excited about this.
All right.
Okay.
All righty.
Listener questions. We've made it. Hey, you guys, I'm a listener of your beautiful podcast. Beautiful. I've never
That's
heard
a good word.
Beautiful.
I know, right?
Wow. And I'm a vet tech from Germany. That's awesome. I was wondering how you guys handle the whole mental health topic in your clinic. What?
Nothing. I thought that was a valid thought.
I was wondering how you guys handle the whole mental health topic in your clinic. Do you have any ideas for me on how I can improve the theme in our clinic? Also, it seems like you guys get along so well, and I was wondering how you do that and what methods you are using for team building. I'm noticing a lot of stress in our clinic, and often we don't have a lot of room for these topics in our daily routine. Thanks a lot, and I'm already looking forward to the next episode at Friendship Way.
So hard.
Great question.
I love this question. Thank you.
I think
Number
that-
one, we actually do all get along. This is not fake.
Yes.
This is Dr. King's favorite question.
Besties.
I do
her
love
favorite
these topics.
topic.
I know. I love these
tell
types
the
of topics.
listeners
Yes.
how you established it because it
Take
started
it
with
away.
you.
Yes, you are the reason.
Take it away.
You were like,
oh,
this is
the
it.
pressure.
Do you want this on?
It
makes
is
you feel
all
better.
then you won't see us staring at you. You can put this on.
yeah, right. There's so many things to unpack here. I think that where do we start, Duckwall? Do you have any ideas?
Okay,
for
let's
me?
start with the first one.
Do you have any ideas? Okay, so I think she's talking about when she says
Like how
I
does
could
she
theme.
improve
I think
the
she's thinking
culture?
culture, right?
Yeah,
Okay. So how do we have any ideas on how it can improve the culture? It seems like you guys get along so well. How do you do that? And the methods you use for team building. Okay. How did we improve the culture? Well, I mean, I think it depends on what her
problem is.
And then also where she sits in the organizational chart of the practice, right?
Mhm.
But I think that
Well,
this
she
is
says
something that
she's a
we've
vet tech.
she's a vet tech, so is she
A
in
lead
vet tech,
leading,
yeah.
kind of a thing. And the important thing to remember is leadership is a mindset, not a position. So, you hear me say it.
Preach.
I know, you hear me say that all the time. So I think that you can take a lot of the topics that we might talk about and apply them.
Mm-hmm.
Okay. And I think this is really important also because there's been so many, even in the United States, like we had that story of the person that, unfortunately, the RVT that came in the practice in Sarasota and then shot the veterinarian,
Mhm.
and so we know that, and that was recently, and then there was another one recently. I think mental health is just a big thing
Yes.
for veterinarians, veterinary staff, veterinary technicians, veterinary assistants. I mean, everybody
Vet med.
in vet med, right?
Mhm.
So
I think the biggest thing is number one, you have to make time to talk about it in your daily.
That's what I was
routine.
going to say. I was like, that's a must. Like,
Yes.
you don't have a lot of room. Well, you have to make room.
Yes.
Like, that's not an option to not have room.
Yes.
Yeah.
You have to
Yes.
make it a priority.
yes.
You have to start that habit.
Yeah.
So I think, how did we establish the culture? The culture was established with core values.
Mhm.
So the first thing we did was establish the core values. And then the core values, which was no surprise to anybody, is the acronym ALL-STAR. So go for it.
Oh, it's been a minute. Accommodating.
Yep.
Loving.
Yep.
Loyal.
Yep.
Skilled and
Yep.
knowledgeable.
Yep.
Timely. Atmosphere. Reliable.
Yeah, baby.
Mm.
So good job. I mean, on cue. I think the core values are the place that everything goes back to. So it's very easy for the staff to understand that all the decision making that they're empowered to make, as well as then that their leadership teams are making, all are surrounded by the core values.
Mhm.
The other important thing is that we took very seriously creating what we call a circle of safety. And so there's a circle of safety that's been created. And there's a great book called Leaders Eat Last by Simon Sinek that you can read that will help you implement this in your practice. But basically, it's a way of creating trust and cohesion within a unit. So that the reason is that if people feel like, if your team feels like they're constantly having to fight dangers within the team, so within their circle, they are no longer allowed to focus on fighting dangers outside your circle.
Mhm.
So things like your competition, or depending on what your industry is, but like, if you want to, be the best, at being efficient in your exam rooms, or, if they can't focus on anything else other than protecting themselves
Mhm.
from the inside. And you don't want that. So if people feel like they're not safe, then they're not able to perform up to their ability.
Mhm.
The other thing that's really important is that by talking about people, so like if you're talking, so the other thing we did here was we put in a zero gossip policy.
Yeah.
Are we perfect at it? No. But everybody knows that that's something that we value.
Mhm.
So, and interestingly enough, brains work in such a way. The reason why that's so valuable is that if people are talking poorly about someone, it actually seeds self-doubt. And if you have self-doubt, then you are not feeling safe. If you're not feeling safe, what can't you do? Perform up
Mhm.
to your ability. So I think that all of it then creates this. If you can establish the circle of safety, then you can now you can grow.
Mhm.
So now people can focus on growing instead of protecting themselves from danger.
Mhm.
Everyone has to buy into it. And the only way you can do that is because if you're in a small clinic and I'm leading a small group of people, not only do I, as the leader, have to protect the circle of safety, but the people inside it need to be willing to protect the circle of safety. So everybody that is an employee, all the way down to high school students, all the way up to a practice manager or a director of medicine or veterinarians, they all have to be willing to say, we value this. And so I think, to your question, how did it ever get this way? Well, you had to start there. You had to create the circle of safety, and then everybody had to buy in, and then everybody had to be willing to live the circle of safety. Again, I don't want to pretend like we're perfect at it. It's okay to not be perfect at it. What you have to do is be accountable. So we have to, as leadership, or you as a veterinarian with your team, or you helping Devyn, or Devyn helping a high school student, you know, it all trickles downhill, you know, and even that high school student saying to Courtney, you know, like everybody has to be willing to protect the culture. Otherwise it doesn't work.
Yep. That's what I was going to say, is that's the most important. Once you establish that safety and you feel like you are comfortable and safe enough to approach someone, then that's when you can not call them out aggressively, but you have a conversation, or you're like, hey, what's going on? You seem a little off today, or something like that. Like,
and I think that it starts in small steps, you know, so this seems like, oh, how could we ever implement this? You know, and it was just done slowly. Don't you think, Courtney? Like, I mean, just over time. And then we're hiring and firing around the core values. Well, eventually you know, the people that you're hiring then are people that can live the core values, right? Because those are the people. It's also our responsibility to make sure people are in the right seats, you know? So like, and these guys have experienced that from the standpoint of seeing people move from a different seat to a different seat. Well, that's because we're not doing our job if we're not setting them up for success. So maybe we need to move them to a different seat so they can be successful. So I think, you know, all of that makes a difference. I mean, I think the question about, it seems like you guys get along so well. That's why. I really do think that's why.
Yeah. Because having that safety then frees up a lot of mental, emotional capacity to get to know each other and to have fun, or, you know, talk about things. I mean, obviously that's second to our job when we're here, but it also allows you to then really be open and seeing like, hey, like, I get along with this person really well. It'd be great to hang out with them. Or
you don't have to be on the defense all the time.
And here's the thing that's interesting again about our brains, is that if we don't feel safe, then we go to a different part. Our processing goes to a different part of our brain that really is only capable of flight, fight, you know, or freeze. That's it. So if you're in that mode, you cannot do any higher processing, you know, which is, you know, problem solving. You know, so if you're focused on that, and that's all you're worried about, you can't problem solve now. And there's other things that you can't do as well. Things that would allow you to do your job well are things that you can't do now because you're in this other mode. And so that's why it's so valuable, right? Because if you want people to be able to provide, you know, growth for themselves, growth for a teammate, growth for the client or the dog or whatever it is that you're working on, then they have to be able to enter that part of the processing section of their brain. And if they're so busy, you know, worried, you know, there are things that can create chaos. And for instance, we experienced this the past several months where as staff, you know, move to other opportunities in their lives, you know, and sometimes it doesn't occur on your timetable, you know, as a manager or whatnot, or as a supervisor. That can create stress. The important thing to know or to recognize is that you don't want to live in chaos. You don't want to have your daily routine putting out fires, because no one will be able to thrive. And so recognizing that, oh, we're in that mode now. Okay, that's short-lived. That has to be short-lived. It can't go on in perpetuity, because that's what leads to the burnout and emotional distress and I think things like that.
We also implemented rounding, which is
that was going to bring that up.
Yes,
That's a technique that.
It's like a check-in with your lead every 3 months, I think. Every 4.
3 to 4 months.
But I think that's a great way of, you know, discussing things that have built up tension.
So I think, you know, Devyn mentions that, and that's a way that started in order to let the employee know that there's always an opportunity to be in front of their supervisor. So we asked the same 4 questions, and then we have a focus question, which was very confusing for everyone. So it was kind of funny. I thought it was cute. So, you know, that's a very good technique to start to get people to know that you care about them. Because the other saying, we have a lot of sayings here because I love sayings. People don't care how much you know until they know how much you care. So I think that that's really important, that gives them, they know, you know, they have an opportunity throughout the year to be able to be in front of their supervisor. And it's not about a review. It's about them as an employee. What's working well, what's not working well, what tools do you need to do your job? Who do you want to recognize? Those are all the questions that every time get asked. So the other thing Devyn brought up earlier in the podcast was we do stupid things like smash things.
So I was going to say team building, I think, is very important.
We spend a lot of time together outside of work.
Which, of course, keep it as professional as possible. But that's just good. Because then everybody doesn't have to act like, oh, I'm at work, I can't say it, I can't have fun. It's fun to go out with your team and do stuff and get to know everybody, and you just get closer and you have a good time, and it's good to let loose.
To that point, it's not like there's a work Courtney and the outside Courtney.
Yeah, that's true.
That's the other thing. It's like we have that ability because we take the time to get to know each other, to know there's no two faces of different versions of us. So
What else did she ask? Let's see here. Methods we are using for team building. So Courtney mentioned depending on if they're hanging out with their doctor group or their department or the entire clinic, I suppose that's so we have 2 events a year that they're in the entire clinic, and then they have department meetings monthly, and then we just do random stuff.
We spend the entire day together, so and most teams do. So that's team building in itself. But
you can do simple things like potlucks. So we put a bunch of themes in a bowl and we pulled out, I think Michaela's doing it every other month or something like that. We pull a theme out and then we'll do potlucks where everybody brings in something that's based around the theme. So we did appetizers or I don't know.
Food.
So there's that.
There's a lot.
Food brings everybody together.
Oh yeah, we do a lot of food.
Yes. It's straightforward, but everybody loves food.
Makes you happy.
Yeah.
You got to do stuff that makes you happy.
People make too many cookies, so they bring them in.
Yep, exactly.
The videos, Harrison's department, essentially is team building in a way because we all have fun and laugh together. So
yeah, the videos are definitely, and I think that was a side effect that we didn't really realize was going to happen. Was the job is so stressful. So when you can blow off steam laughing, right? Because you can't do both things at the same time. You can't be mad and laughing.
Yeah.
So laughing is a way of releasing all that stress and that tension. And so it's a good outlet for sure.
I was gonna say I was having a really bad week, and when we filmed the vet clinic episode with where the noise one or whatever, I was having a horrible day, and that video, that turned my whole day around because we laughed so hard.
Yeah, Amber's thing was so funny. I just love Amber's with her headphones on and the vacuum. It was just great.
Leadership has what do you call it? The care cart or something?
Oh yeah,
a cart that goes around with snacks and drinks. If there's puppies, we all actually literally try to show each other the puppy.
We take the puppy around the clinic.
Take the puppies around the clinic.
So there's just little stuff daily.
But yeah, I think did we get through all
I think you did a pretty good job.
Yeah. And
Thanks,
then
man.
read some books, right?
Read some books. Leaders are readers. So, so I have an entire list. If you need
write
any,
down the doctor's office on the wall.
Yes, I can take a picture of the doctor's office. That's right.
We have a lot of sayings on our wall.
Yep, we do. Exactly.
Yeah.
Because it's really important what goes in your head. If you're listening to sad things or you're listening to what you put in your head, is really important. It really can change.
There's a lot of self-accountability. Accountability with this too. Self-accountability.
Work on yourself first.
Yes.
Yeah. And then work on everybody else.
Translate.
Absolutely. But it's great for you for recognizing that it's something that can make a difference.
Yeah.
So that's awesome. That's the first step.
Say, Devyn?
I was just going to say that sometimes when the day gets away from us, even Duckwall and I will there have been a few instances where we text the remainder of the night, just kind of talking about the day. Yeah. And that really helps.
Yeah. Just to say, how you doing? Are you okay?
Sure
Good job.
Talking to your people.
Right. And how you measure success will be the last thing I say. Don't, make sure you're measuring yourself correctly. So to your point of my day, was my day really, successful? You did have a good day, but sometimes that can get lost because of how you're measuring yourself.
Yes.
So make sure that you have an appropriate way of measuring yourself.
Yep.
Every day has ups and downs.
That's right.
Yeah.
Exactly.
That's true. Okay.
All right,
I think we did a pretty good job. I think Dr. King did a great job.
Killed it.
So if you need anything else, resources, contact her. Okay. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We will see you in a few weeks for the next episode of the
Veterinary Roundtable.